Welcome to my channel Medicine Guide. Naltrexone is a prescription medication used to treat alcohol use disorder and opioid use disorder. It helps you stop using these substances and remain off them. In this video we will discuss some crucial facts about its treatment and side effects, so let's start our discussion. But before that, please subscribe to my channel. So now let's start with its drug class and mechanism of action. Drug class and mechanism of action. Naltrexone belongs to a class of drugs known as opioid antagonists and works by blocking the opioid receptor. It blocks the effects of alcohol and opioid medications, preventing the intoxication these substances cause. Naltrexone also modifies how the hypothalamus, pituitary gland and adrenal gland, hypothalamic-pituitary-adrenal axis, HPA axis, interact to suppress the amount of alcohol consumed. Dosage forms available. Naltrexone comes as an extended-release intramuscular injection, Vivitrol, and as oral tablets. The branded versions of naltrexone tablets, Revia, Depade, have been discontinued, but generic versions are available. Naltrexone tablets were first approved by the U.S. Food and Drug Administration, FDA, in 1984. In 2006, the FDA also approved Vivitrol, the extended-release intramuscular injection form of naltrexone. Naltrexone treatment. What is naltrexone used for? Naltrexone is a prescription medication that is used to treat alcohol dependence, for the blockade of the effects of exogenously administered opioids, to prevent relapse to opioid dependence, after opioid detoxification. You should stop drinking alcohol or using opioids before starting naltrexone. Naltrexone hydrochloride should not be used in children and adolescents under 18 years. Side effects. Naltrexone can cause serious side effects, including 1. Risk of opioid overdose. It is important that you tell your family and the people closest to you of this increased sensitivity to opioids and the risk of overdose. Get emergency medical help right away if you have trouble breathing, become very drowsy with slowed breathing, have slow, shallow breathing, little chest movement with breathing, feel faint, very dizzy, confused, or have unusual symptoms. Talk to your healthcare provider about naloxone, a medicine that is available to patients for the emergency treatment of an opioid overdose. 2. Severe reactions at the site of the naltrexone injection site reactions. Some people have had severe injection site reactions, including tissue death, necrosis, while receiving naltrexone injections. Some of these injection site reactions have required surgery. This medication must be injected by a healthcare provider. 3. Sudden opioid withdrawal. Anyone who receives naltrexone must not use any type of opioid, must be opioid-free, including street drugs, prescription pain medicines, cough, cold, or diarrhea medicines that contain opioids, or opioid dependence treatments, buprenorphine or methadone, for at least 7 to 14 days before starting this medication. Using opioids in the 7 to 14 days before you start receiving treatment may cause you to suddenly have symptoms of opioid withdrawal when you receive treatment. Sudden opioid withdrawal can be severe, and you may need to go to the hospital. You must be opioid-free before receiving naltrexone unless your healthcare provider decides that you don't need to go through detox first. Instead, your doctor may decide to give this medication in a medical facility that can treat you for sudden opioid withdrawal. 4. Liver damage or hepatitis. Naltrexone can cause liver damage or hepatitis. Tell your healthcare provider if you have any of the following symptoms of liver problems during treatment with this medication. Stomach area pain lasting more than a few days. Dark urine. Yellowing of the whites of your eyes. Tiredness. Your healthcare provider may need to stop treating you with this medication if you get signs or symptoms of a serious liver problem. You must inform every doctor that treats you that you are taking naltrexone. Non-opiate-based anesthetics should be used if you require an anesthetic in an emergency situation. If you have to use opiate-containing anesthetics, you may need higher doses than usual. You may also be more sensitive to the side effects, breathing difficulties and circulatory problems. Dosing information. Tablets. Alcoholism. The recommended dose is 1 tablet, 50 mg, once a day. Opioid dependence. Start with half a tablet, 25 mg, and if no withdrawal signs occur, increase to the dose to 1 tablet, 50 mg, a day from then on. Intramuscular injection. The recommended dose is naltrexone 380 mg delivered intramuscularly, IM, as a gluteal injection, every 4 weeks or once a month, alternating buttocks for each subsequent. That's a no for this video. If you want to watch more videos like this, please keep watching my channel. Disclaimer. Channel's intention is to make sure that its consumers get information that is accurate, reviewed by an expert and error-free. However, the information mentioned here should not be used as a replacement for the advice of a qualified physician. The information given here is for informational purposes only, which may not cover all possible precautions, side effects, contraindications or drug interactions. Consult your doctor and discuss your queries related to any medicine or disease. Thank you for watching the video, and do not forget to like, share, and subscribe to my channel Medicine Guide.